I came during some tumultuous times for the University of Chicago. For nearly 25 years, the medical center hadn't had a level 1 adult trauma center, and it's sitting in a community that has high rates of crime and violence, and persons who were impacted by violence, in order to be cared for, had to be transported outside of the community for care. Yeah, people were angry. You know, I knew what it took to engage with community, and I knew that that meant that I had to be present, that I had to be in the community at community events, I had to be at faith events, I had to be at house parties, but people were still angry. But they hadn't historically had this opportunity to be in front of the leaders of this institution to have that conversation. But the point in which I really knew the difference is when we formed a community advisory council and we invited 5 of the major trauma protesters to be on that community advisory council.
I'm Reverend Julian DeShazier. I am the pastor at University Church. I've been here about 14 years. I'm a Southsider born and raised. So the Community Advisory Council sort of comes out of knowing that the university needs to be in better relationship with the community, not making decisions for the community, but making decisions with the community. We're starting to see things actually happen. We're moving from that space of, oh, they're talking about funding this and doing some programming here, to like, no, the program's been going a couple years. Here's some data, here's what we've learned, here's how we're gonna adjust this to be even more effective in the next year or two. And so you're seeing, when you see the work happen, then it does a lot for that trust.
Being with the council since the beginning, we've definitely had some growing pains together, but I think the reality was the university did want the input from the community. It was just, how do we get a good rhythm to make it work, right? What did they do with the information once they received it? And I've seen through the years the responsiveness of the university will bring things to the council, and within months we can see some change begin to happen.
We started designing all of our programs with the community. Help us build the intervention around asthma. Help us build the interventions that we're going to do around diabetes. When you look at the data collected from the community through surveys and focus groups, and the data that's in the public health domain, the secondary data, and you combine that data, what the community said their health needs were are identical to what the public health outcomes say the needs are. So the community knows what their needs are. They know what they're faced with every day.
A lot of times, researchers or hospitals collect data, and our community residents never know what happens with the data. That's not the case with the Urban Health Initiative. What happens immediately after that is that we start strategic implementation plans to help us understand, all right, what did we hear from our residents and what can we do about it? I'm very proud that there are programs that we have, such as the LINK program, which is our community health workers program, that's targeting those chronic diseases to help patients navigate service lines and resources to help them address issues connected to chronic diseases. And then also we have advocates that can help patients find medical homes and specialty care through our Patient Advocates program. I'm very proud that we have one of the most robust hospital-based violence intervention programs in the nation through our Violence Recovery Program that addresses violence intervention and, most importantly, prevention to avoid patients that are violently injured from being re-injured, and then, most importantly, helping piece the puzzle around what they need for comprehensive recovery. We launched our hospital-based violence intervention program on the same day that the Level 1 Trauma Center opened. And so we're very proud that we've had an opportunity to grow One way that we grow is through the wonderful contributions of the BHC, the Block Hassenfeld-Cassidy Collaborative. You know, we're on the south side of Chicago. We understand that because of failures that have happened institutionally, trust is incredibly important. How do you generate trust? You generate trust through relationships. Relationships that require having frontline individuals at the hospital that actually know about those experiences because they live those experiences, because they're from those neighborhoods.
Hi, my name is Trey Noashinsky. I work for the University of Chicago Medical Center. I'm a pediatric violence recovery specialist. Welcome to Woodlawn.
So I grew up in part of the South Side. I grew up in the Pilsen area, predominantly Hispanic area.
So I am originally from the South Side of Chicago, born and raised. That's my connection, experiencing firsthand kind of what health inequities look like, which brings me to this role.
They don't see us as like a clinical professional. They kind of see us as a community member that's just checking in on them, that's getting to know their worries and their concerns, and you meet their family members, really get to know them on like a person-to-person basis.
But to see patients feel so empowered, to see them light up, to see the weight off their shoulders we feel like baby superheroes in the community.
It means everything that they're gonna have a phone call a few days after they leave the hospital. How are you doing? I'm so sorry that you went through this experience. Is there something that we can do? Are there any kinds of resources, any kinds of emotions or feelings that you're noticing in yourself? If so, here are X, Y, and Z resources that we can offer you right now, today.
30 plus years ago, my uncle was a victim of gun violence, shot in the head. I think my experience, my family experience with losing my uncle was something that drove my passion to do this work. So for me to be able to support other family members and community members, children, families, and things of that nature is huge for me. It helps, it's healing for me.
Through the Urban Health Initiative, UChicago Medicine is building lasting community relationships and addressing top health issues such as trauma, chronic disease, and social drivers of health.
We worked on pediatric asthma for 10 years, and we've reduced emergency room visits for pediatric asthma over 50%. We've reduced kids missing schools about 59% because we spent 10 years working on asthma. And we have one of the lowest trauma recidivism rates in the country, 2.5% compared to 14.9%. We put over 200 brand new jobs into the community. These are living wage jobs where people can make a living and support their families.
It's critical that everyone has the opportunity to live their healthiest life, no matter their zip code.
We developed and created important programs. They were all developed and designed with the community. The Urban Health Initiative is full of innovators. I'm excited that this team of innovators is ready to take the Urban Health Initiative to the next level. We built a foundation that can go on for generations, however as long as needed, to continue to do this important work in our community.